Hello, welcome to this special edition of Health and Wellness on NewsX. I'm Akshay Tandon. In today's edition, we'll be focusing on arthritis and how we need to make people aware about this disease and how it needs to be appropriately managed. To talk about this in further detail, today I have with me two panelists. We have with us Dr. Narayan Hulse, Director, Orthopedics and Joint Replacement, Fortis Hospital, Bangalore. Let's make a start with Dr. Narayan Hulse of the Fortis Hospital in Bangalore. Doctor, thank you for coming on the show. It's a pleasure talking to you. Let me make a start by asking you, sir, a report suggests that by 2025, almost 7 crore people are going to be affected by arthritis. Please help our viewers understand, Doctor, how and why this condition is impacting our daily lives so significantly and what can be done.
Arthritis is a very common condition. It affects a lot of people all over the world. The incidence of this disease or this chronic condition is increasing basically because of the increase in the awareness about this disease in the public, and also because of the increasing life expectancy in our country as well as in many developed countries. And arthritis affects especially both knee joints, and in some people in the hips and spine and other joints as well. Because of the involvement of the main weight-bearing joints, people have a lot of difficulty in their daily life. And because the incidence or the occurrence of the arthritis is increasing all over the country and all over the world, we have to be prepared to deal with them in the future, I think in more and more numbers.
Doctor, let me also understand, on several occasions, joint pain, stiffness, inflammation can be associated with some sort of an external injury. Now, are there any other prominent symptoms that you would like to tell us of how people can determine that they're actually suffering from arthritis?
Arthritis generally means there is pain in the joint, because arthro in Greek language means joint and itis means inflammation or something like a painful condition.
Okay.
So arthritis is associated with mainly pain in the affected joint. So the patients will complain about knee pain, hip pain or back pain depending on where exactly is the arthritis, or in some patients it can be involving multiple joints called polyarthritis. So there's a main problem with the arthritis pain occurring in the particular joints. The second problem is reduction in their mobility, which becomes a difficult problem in elderly. So you have a lot of pain in any joint that hinders their mobility in their daily activity. This depends on the age also. For example, an arthritis in a young person causes a lot of problems in his work and a lot of other activities he would like to do. Whereas in elderly, it can hamper their basic daily needs. For example, going to the toilet, bathroom, or a little recreational activity, etc. So arthritis can cause a lot of these problems in their daily activities with symptoms like pain and also reduction in their mobility. Some of these patients may develop advanced other problems as well. For example, they can start developing deformities, meaning they can have a bent bone. For example, all of you might have seen something like a bow leg. If you have a bow leg because of arthritis, it looks odd, it is painful, and it also leads to a problem like hindrance in their daily activity.
But doctor, can you tell us in further detail, what is the trigger? What is really the trigger for this painful bone ailment? Like, can it be, for example, a bone dislocation, fracture, or a bone injury that contributes to arthritis?
Yeah, arthritis is a very generic term. As I was explaining earlier, arthritis means some kind of pain occurring inside the joint, which is derived from the Greek word. So any inflammation or any kind of injury, trauma, or any kind of not properly healed old fractures can lead to arthritis. Sports injuries, not properly treated fractures, previous infections, body weight, all of them can cause increased stress on the joint. What actually happens is a soft lining on the bone called cartilage gets worn out. So the cartilage, which is like a soft rubber kind of tissue inside the joint, slowly becomes a rough and a hard surface, and the bones start rubbing on each other, leading to a lot of pain in the joint, and its sequences will continue like mobility derangement and pain, and that can cause a lot of problems in their daily activities.
Can you tell us, Doctor? Can you tell us, Dr. Hulse, what does arthritis diagnosis actually involve? And once diagnosed, what are the treatment options that are available to patients?
Arthritis is mainly diagnosed by clinical examination of the patient. Diagnosis also depends on what kind of arthritis we are talking about. For example, the commonest arthritis what we see in this country is wear and tear arthritis, which comes in elderly people, and we call that as osteoarthritis. And this arthritis can be diagnosed without any test or investigation. As the patient comes in, elderly person with a lot of pain in the knee joint, and he has a little creaky sound in the joint when you move, and he may have a little bow leg. That itself will diagnose us that this gentleman has a wear and tear arthritis of the knee called osteoarthritis. However, this can be confirmed with a simple standing X-ray.
Of course,
usually
yes.
No blood test or X-ray or scans are necessary. That's why diagnosing an arthritis, especially an osteoarthritis in an elderly chap, which is the most commonest problem, is not difficult. However, there are other types of arthritis.
Right.
Maybe around 100 types of arthritis are present in human beings, and of which some of them may need blood tests, different kind of scans, depending on the type of arthritis we are dealing with. For example, in rheumatoid arthritis, patients will be requiring some kind of blood test, at least one, to diagnose the problem properly, and also to monitor the treatment. How good this treatment is actually helping these patients can be found out in the blood test, and also if there is any side effects of the drug or the general status of the patient can be managed or diagnosed with the help of the blood test.
Doctor, I have a concern from the patient's point of view. You see, going under the knife is considered to be a very risky event by patients. People are not comfortable undergoing the surgery. Are there any other methods or mechanisms through relief can be brought about? A joint replacement with painkillers, injections, physical therapy, etc. And when do you think, doctor, that a surgical treatment is really the last resort when it's actually recommended?
Yeah. So joint replacements are really a boon to the patients who have severe arthritic pain. Joint replacements are advised when patients have severe pain which affects their daily activities.
Okay.
For example, a patient suffering from osteoarthritis or a rheumatoid arthritis in their knee for many years.
Yes.
He was managing that pain with the help of either physiotherapy or painkiller medicines or sometimes injections. At some stage, when the arthritis is so severe, none of these treatments is going to be effective. At that stage, we advise them to have a joint replacement surgery. So joint replacement is done so commonly all over the world, and the number of joint replacements done every year is increasing, basically for the reason that they give great pain relief and mobility to these patients. For example, if a patient is on a chronic long-term painkillers, he can develop a lot of side effects. And if you have injections into the knee, kind of steroids or some kind of lubrication, viscosupplementation, what we call, they are all going to be temporary only. Whereas if you do a joint replacement in an elderly chap for many years, they will not have any problem in terms of their pain, mobility, as well as they need not take any medicines which can cause side effects on the body. And there is no other treatment which can improve the quality of patients who have severe arthritis compared to a joint replacement surgery. And that's why in the last decade, for example, the famous medical journal called Lancet described hip replacement as the operation of the century. In terms of the quality of life improvement, these joint replacements are considered as the best operation available to the human beings.
Okay. Dr. Hulse, I want to know another thing from you. News has been doing the rounds that researchers have been able to develop a silicone implant material that can help the cartilage regrow. So what's your take on this news? What does the research really say? And how effective really do you think can it be where Indian patients is concerned? Is it a long-term solution for them? What do you think?
These messages as well as these research news have to be taken very carefully by the population of this country. Most of the researchers have never grown a cartilage strong enough to treat the conditions like osteoarthritis or rheumatoid arthritis. Most of these similar kind of medicines are available for a younger people who have very limited cartilage damage, but it is never going to be strong enough to replace the human cartilage at the current level of research. In the future, a lot of other research is going on. None of the medications, alternative therapies, or the new research like what has been mentioned have never shown scientifically good enough to replace the cartilage. So at this stage, the best treatment for those patients who are elderly and who are suffering from severe pain is only joint replacement. And any other treatment has to be questioned if anybody is either selling them or publicizing them.
Okay. Doctor, now can you tell us, this is extremely crucial for the knowledge of patients in terms of what care, what aid should patients take the post, surgical phase. So what are the crucial aid healing and faster recovery methods the patient should take or undergo?
Joint replacement surgeries are very effective surgical procedures, and they are done very successfully in most of the places in our country. After the joint replacements, usually patients start walking little within 24 hours or so. And within 3 or 4 days, patients are self-caring in the sense they are able to go to the bathroom and toilet. And then they are also, in most of the patients, allowed to climb stairs also to a limited extent, and they are discharged home from the hospital. So when the patient is going home, he has no injections, no drips, no dependency on other people for their basic needs. And as the time passes, for example, in around 2 weeks, 3 weeks time, they can start little minor extra activities at home. Okay. By around 6 weeks, most of the people will be able to do the activities which they were doing before the surgery. However, the knee replacements tend to improve over a period of time up to 3 or 4 months gradually, day by day, as the flexibility of the joint improves, the strength in the muscle improves, and they get recovered from the operation itself.
Dr. Hulse, is it possible, there are sports enthusiasts who also undertake such surgeries if need be, or go under the knife if required, but can they get back to these sports that they would play, badminton, basketball, cricket, tennis, etc., after, for example, a knee replacement? Is it advisable that they can, or are there any restrictions when it comes to a new a joint that has been replaced?
Yes, the joint replacement surgery, the basic to understand is that they are done in elderly patients needing pain relief from their joint pain, so that they are independent from the medicines and they are independent for their basic needs. So the basic idea of replacing the joint is not to put these patients to either basketball or a badminton kind of sports. And we can understand that in the patients who are in their 6th or 7th or 8th decades are really not interested in the basketball or in the football game to play themselves. And hence, the patients who have joint replacement surgery can do all the activities, whatever is necessary for their age. However, high impact activities like badminton, football, or running kind of activity which are unnecessary in that age group are not recommended. And other restrictions we normally pose to these patients is not to squat much on the floor on a daily basis, because sitting on the floor and getting up can lead to a lot of stress on this knee. Otherwise, the patients of this age are able to do all normal activity, whatever is needed for that age after the joint replacement surgery without pain.
Okay. Dr. Narayan Hulse, thank you very much for taking our time and speaking to us on this very important issue. It's been a pleasure, and thank you for telling us about the options available for arthritis patients.